Good afternoon and a warm welcome to University of Central Asia's online public lecture today. My name is Shaukat Ali Khan and I am the Chief Information Officer at the University of Central Asia. I am really excited to be the moderator of this very interesting lecture today. Our topic is Playing with Lives, Cyber Attacks on Healthcare or Attacks on People, a research study from the CyberPeace Institute. We are organizing this online public lecture in collaboration with the CyberPeace Institute, Geneva, Switzerland. Our today's speaker is Bruno Halopeau, Chief Technology Officer, CyberPeace Institute. Bruno is a seasoned professional with more than 20 years of experience as a managing consultant, leading secure digital transformation projects in various industries, spent several years as Chief Information Security Officer for a European Union body, acted as a team lead expert in the fight against cybercrime and terrorism on topics such as critical infrastructure protection, exploitation of emerging technologies of criminal gains, forensic and investigative techniques in cyberspace, and then led development of innovation strategy program for law enforcement. Please welcome Bruno Halopeau.
Good morning, good afternoon, everyone. I'm very delighted to be here today to present to you this study we have been conducting since several months at the CyberPeace Institute. I will share my screen so that you can see a few slides throughout this discussion. And before we start, let me give you a bit of a background, why we did this study and why we did this report. First, we started around a year ago to develop a project, which was called Cyber for Healthcare. And the initial aim of this project was to have a matchmaking initiative between healthcare professional in needs on one side and the cybersecurity professional who could provide help for free for those healthcare professionals who could not afford it, especially during this COVID period, where we could foresee and see concretely an increase of cyber attack against this sector. As we saw that this project was having quite a big success, we wanted also to know more about what was the problems and the solution which could be recommended for this sector for being published more widely than just to the healthcare professional that we were giving help to. So we transformed this into a program that now we call Cyber for Healthcare program, which is a way to collect and consolidate scattered information together and to understand the impact on people and society as a whole. Because we believe it is very important to really look at the impact, especially on the most vulnerable. Then this report is, if you download it, you will be able to see that there are some key findings and some recommendations. So I will start with the findings and I will explain how we come up to those main findings. We can see that first, this sector is a sector which is impacting people, obviously, patients, but you can see that cyber attacks may have a direct impact or a concrete impact directly to the patients, but also to the healthcare services that deliver their service to the public. The second level is we see an increase of attacks. Why is that? Because usually cyber criminals look at lucrative and relatively risk-free areas to attack. And they saw that during this crisis, where there has been a lot of pressure on the healthcare systems, that it was a sweet spot for them to develop and to get some financial gains. It's also near impunity, so you see little prosecution, and today we see that with the key finding number 3, that really there's no real mechanism, transparent or independent, to track accountability. So to attribute responsibility and to understand who should improve into the overall system. We'll come back into details throughout the discussion today. The fourth one, the healthcare professionals and patients, they do not really benefit fully from the legal instruments which are already existing. So if a states and enforcement bodies would be able to improve that, we will see more control or even a decrease of those cyber attacks. Another point we saw still in key finding 4 is we have many initiatives that exist, assistance initiatives mainly. Some of them developed by the cybersecurity community to help directly the healthcare sector, but they really lack visibility, scale, and sustainability. So let's first talk about the context. Why the healthcare is under attack? It's in fact a concentration of several factors. So the healthcare are usually organizations that are gatekeeper of sensitive information, right? You have health records, you have research, medicine research, it can be vaccine research, it can be any type of information that deals directly with patients and how to conduct healthcare in certain countries. Also, stolen medical records can be traded in the underground markets on the darknet, generally for some fees which can be quite generous or can generate generous profit for the attacker. And another factor is intellectual property from medical research, for instance, can be very profitable for the person who gets access to. One element is also that the healthcare organization are more likely to pay ransom request, since first they deliver services which are quite critical, and service disruption can have very direct impact on patient health. And also with whenever you have a sector or a company or an activity which is under pressure, meaning like the COVID pandemic pressure, the likelihood to pay a ransom to be back operational, is higher. And what I wanted to mention here is this is not a new phenomenon, and this is the nature of the internet, that is a global phenomenon. It's not only touching specific countries or touching specific regions, it's global reach. So usually the sector is a target of choice, as you can see on the screen, for both criminals or state actors, either for financial gains, information acquisition, or for achieving their own geopolitical agenda. So the next slide. Yes. So still in the context, first on the left side, the pandemic is giving rise to a convergence of malicious and irresponsible behavior. The three main ones we could see is obviously the evolving ransomware attacks that you may all have heard about. So it's quite at the top of the news recently that healthcare facilities are attacked. But it's also data breaches, stealing company secrets or accessing data records, etc. And one which is being underestimated is more disinformation operations. I will come into details of that in a few minutes on each of them. Also, to explain why the healthcare suffers from a number of vulnerabilities, it is because this sector has been undersized at many levels. The first level is more at the digital infrastructure. So they often operate complex, vulnerable, and sometimes outdated infrastructure. So hospitals run multiple types of devices in their network. Those networks are not necessarily built in a proper way with proper segregations or proper zoning. So it makes them more vulnerable. The outdated infrastructure, whenever you have medical devices, which are quite expensive, they are often delivered with operating systems which are running on it. And at some point, those operating systems may become outdated and not supported by the vendor. In this case, obviously, any new vulnerability discovered will not be patched because there's no support and there's no update anymore. So MRI device can be part of those, like pump injections, automated can be also part of this. So this is becoming a growing problem on how can we sustain security and cybersecurity with outdated and legacy systems. Second level is technical and human resources limitation. Whilst there's a minority of big healthcare actors who have deployed strong and good cybersecurity programs, we could see that the vast majority of actors in the sector, they are suffering systemic lack of resources. And this systemic lack of resources is to secure infrastructure, to train personnel in cybersecurity, or even to retain or to hire personnel in cybersecurity. Obviously, when you lack this, you have some consequences, and one of them is it prevents proper protection, preparedness, and exercising of your infrastructure to be sure that it's attack-proof. And second level is also decreasing your response efficiency, since you are lacking the skills internally that can help mitigate as fast as possible a spread of malware or spread of an attack within your network. Last but not least, many healthcare hospitals or facilities usually spend an overall budget of 4 to 7% of their IT budget, which is much less than the average of all sectors together, which is around 15%. So there should be also prioritization of budget allocation in a network to increase this part, to be sure that proper equipment is purchased and implemented. Now, who are we talking about? Which are the victims? So obviously, like any sectors, you have many facets on that. Obviously, one of those is the society as a whole. So if the volume of cyber attacks becomes too big, it will have a strong impact on the society as a whole. Obviously, it impacts real people, individuals and patients, but also it impacts healthcare professionals where they could be facing situations where they cannot deliver their services as usual, or to be back to practices which are more manual or more pen and paper. But the vast majority of the sector is composed of hospitals, medical facilities, research centers, laboratories, health insurance companies, but also ministries at the government level, civil societies which are providing help or service to the healthcare, and pharmaceutical companies. Last but not least, and it's often overlooked, is the supplier and manufacturer. So whenever you have a company or you have an hospital to run, you need to rely on a range of supply chains or suppliers, which could be consultant, which could be supplier of software, supplier of device, which have to be supported, and be sure that they are all secure at all the time. So if we think about the impact of this, 93% of healthcare sector over the last 3 years have been suffering some sort of cyber attack or cyber incident, 93% in the past 3 years. And especially in 2020, we saw an increase of 6-fold of attacks on this sector in particular. So let's take some example of a wide variety of attacks that you can see in the report, and you can see here in this slide. In let's say the sector of hospital and medical facilities, in 2020, end of 2020, in the US, Universal Health Service has been hit by a ransomware, meaning that all systems were disconnected and the network were shut down to prevent propagation. at around 250 care facilities and hospitals. 250 facilities were disconnected from the network and from the internet. So that is a massive, massive impact on the operation of this company, and obviously to their patients. Second example I can take here in the medical and biomedical research institutes is the Hammersmith Medicine Research in the UK. IT systems and email were disrupted for a day, a complete day. And they saw that data were leaked out, medical data and sensitive additional information of 2,300 patients around. At the level of governments and health ministries in Georgia, the health ministry in Lugar Center, there have been some indication that some data were leaked out, but also one important element was some data were manipulated or falsified document within the system, so to attempt at the reputation or the credibility of the ministry. At the manufacturing level in China, still in 2020, Huawei medical company saw a theft and a leak of source code of artificial intelligence assisted COVID-19 detection and experimental data. This is something that is quite worrying, because you could imagine that either this code has been used or reused to try to understand how this algorithm works to poison data, or to get this code to be able to have some more intellectual property to resell to someone else. In 2020, still pharmaceutical companies in India, Dr. Reddy's laboratories, they had to temporarily shut down operation in many plants, which were located in the US, in the UK, in Brazil, India, and Russia, due to a ransomware also. So data leak was also suspected shortly after, and it was about COVID-19 vaccine trials data. One example I can take also in the health insurance part, which is not showing here because it was in 2015, it's Anthem Blue Cross, where 80 million patient records were stolen, 80 million. And last but not least, the civil society. I can take an example here on the graph about Northern Light Health Foundation, where personal data of nearly 660,000 donors and patients were compromised and stolen. So you can see that the problem is quite huge. It's not limited in scope of specific geography, and you have different type of attack that are running out there. So what are those type of attack? The one which are impacting the most the healthcare sector that we outline in the report also is first ransomware, which is the most prominent and continuously evolving threat. Second one is a cyber espionage, which is by definition a covert threat. And the last, disinformation and infodemic, which is often underestimating, and I will explain why. Let's go for the first one, ransomware, and a bit of history. Ransomware is not a new phenomenon, as it was first used or first invented in 1989, and it was already targeting the healthcare. It was a scientist at the World Health Organization AIDS conference who distributed around 20,000 floppy disks, so little disks that you could put on your computer, where you had a Trojan, a malware that would install on your computer and encrypt the files and show a message saying that to get the decryption key, you need to send some money via wire payment in Panama, in anonymous account in Panama. So the phenomenon is not new. It has increased really a lot over the years. If you look at the evolution profile, initially it was more like having a wide infection and with a small amount to pay. So you was targeting any individuals he could find with a small amount that not even deserve to report to the police. so that those criminals were getting small amounts, but multiple times. So you see the small amounts ransom on the left side, and opportunities target within, which is like I don't target specific person. However, this model was not working that well, and we see over the years that there's a striking number, lowering number of attacks, much less, but now they are more and more targeted. So you have higher ransom demands, but much less attacks, but much more targeted. And in this sophistication and market development, certain ransomware operator mentioned that they would not target the healthcare sector, but we didn't see it in reality, and they were still targeting the healthcare. Maybe it's too profitable. If we can have some numbers also, the value of a data record, if a good medical record can be sold on the darknet at around $300 to $400 per record. And we saw an increase of ransomware between November 2020 and January 2021 of an average of 22%, but 45% in the healthcare sector. So meaning that the targeting is not only targeting valuable company, but it's valuable company also specifically in the healthcare sector. We see also strike increase, as mentioned, of the demands. In 2018, it was around 6,000 ransom per demand that was requested, which was multiplied by around 12 in 2019. And we don't have a definite number for 2020, but it's estimated to be around 178,000 to $233,000 for ransom. Also, what you have to understand is if it's a small actor or small company, this demand will not be as high. They will be around maybe 6,000, 7,000, because those criminals, they want to increase the likelihood of payment. So it has to be sized to the size of the company also. So the impact it has is around the overall 20 billion of cost to recover from a ransomware attack. So what does it mean? The cost goes into stopping an infection, recover from systems, restore data, test system, patching, reviewing access, reviewing network infrastructure. So this is a huge work, which costs a lot of money, much more than the ransom by itself. And it takes an average of around 80 days for a company to be able to recover from a ransomware attack at a certain date to be able to be back on the full operations. And it requires obviously skilled personnel that the company may not have, so it will incur even more cost. In terms of estimated number of victims that pays, it's just an estimate because it's very difficult to understand who pays or not, because most of the time companies are not willing to disclose this. Second of all is you have more and more cyber insurance that pay for those ransom also, and it's not advertised or it's not tracked as a definite number. So the estimate is around 25. It has also various payment numbers based on the different countries or region. So what is very important to know is half of the companies, after a survey that was made, say that they are not ready to face a ransomware. That's very worrying, and those companies will be inclined to pay the ransom, especially since they don't have backup, obviously, but since the value of the file can be much higher than the ransom, and they will be forced to pay. The advice is obviously not to pay, never to pay, because first, it doesn't guarantee that you will get a key for decryption. Second, it will not guarantee that you will not be re-victimized or re-targeted. And what you have to know is usually cyber criminals, if you pay, put you on a kind of good customer list where you would be retargeted in the near future or after a few months. So how does a ransomware work in reality? So the first thing of ransomware is to find an entry door, right? So you have a criminal that will either use either an email, which is using phishing or spear phishing. So phishing or spear phishing is an email which is crafted for a certain person or for certain audience that will encourage this person to click on certain link in this email. So this is called kind of a social engineering. This is one entry point. Another one that you see, RDP on the screen, is exploiting remote services. Usually those remote services is to access system from remotely, and especially now in the COVID, where you have your IT administrator who might be working from home. Remote access is enabled almost everywhere. The problem is those remote access connections are not sufficiently well secured. So it means that login password can be brute forced or can be figured out, and the criminal networks are hunting for that, so they can get direct access to the heart of the network of the victim. And the third, which is not showing here, is exploiting vulnerabilities in software. So there's no software on the planet which is 100% safe. You may have always vulnerabilities that can be found, and it's a matter of being sure that between the moment a vulnerability is found and the end customer who is using this software has applied the patch, during all this period, the company, the victim, is vulnerable. So the goal is to really shorten this as much as possible. So how does it work? The email received is sent to let's say an hospital. Then you have a healthcare professional which open the email, click on the email, and what happened? The email will then install on the computer and will seek to propagate either laterally or inside your network through open ports or for the services, through the file systems, or try to exploit further vulnerabilities, or try to elevate the privilege to get access to more and more machines. Once this malware is well installed in your network, it will, via botnet, inject a ransomware, which will do the job of encrypting all the data of all the computers which were able to be hit by this malware. So obviously here you have two options. Either you have an option where you can recover from it, which is the blue part. So it's costing money, obviously, but at least you don't have to pay the ransom, or you don't have enough skills, backups, or ways to recover your data, and you will be obliged to pay it. The idea here is obviously to help those healthcare organizations, as I mentioned in the beginning, with the Cyber for Healthcare program, to be sure they are ransomware proof and they prepare their infrastructure and their services so that they can be recovered at some point, not to be stuck in a way that they will have to be paying the ransom. So obviously, since now a company starts to develop backup systems of their data, and they are becoming more savvy on that. The criminal network groups, they evolved, obviously. And now they evolved to what we call a double extortion. So it's going to be the same mechanism to infect, but instead of encrypting all the computers and all the servers, they will first extract data from the databases, from local computers, and this will be extracted and owned by the ransomware operator. It has been developed since 2019, November 2019, and we estimate it is around 50% of the attack today on ransomware. So the double extortion is there to put additional pressure on the victim to pay, because on one side you have your system off, but on the other side you are threatened to have your data released in the wild. And this is to have a goal to increase the likelihood of payment. So how this ecosystem works behind the scene. You have two elements. First is what we call ransomware as a service. So it's a model that allows skilled individuals to become affiliate of established RaaS packages or services. So on one side, you have the operator, which is developing the RaaS service. And on the other side, you have skilled individuals who would like to make money. So the work is split in a way that the operator give almost for free compared to the reward, the ransomware kit. So they made it available to some people. And those people will be in charge to find or to breach or to carry out attacks on the network to infiltrate the ransomware as a service in there. So this cooperation, we see that affiliates gets around 70 to 80% of the payout, while the operator keeps 20 to 30% of the payout. 20 to 30% might seems a bit low, but it's unfortunately today the amount of ransomware which are paid, ransom which are paid, are quite high, so they make significant money. Obviously, operator, they want to be sure who they associate with affiliates. So you have a strong recruitment process, like applying for a company. So you have to pass interviews, you have to show your skills, you have to answer questionnaires, and then there will be a strict vetting process for the operator to be sure that there's no infiltration by police or intelligence service. Then when we talked about the double extortion, data are exfiltrated. So what happened to this data? This data is then sold on the darknet. And usually, I think you have around 20 operators which host their own dump sites. So data are exfiltrated, and there's a portal where usually you have a web page for the victim to see when the data will be released with a countdown. So it will share your data will be released in that many days, etc. And the countdown. This is to instill fear again, to make them pay for it. And those leak sites are then used to sell, once the time is out, used to sell those data to other people who can do further attack or further extortion. So it's a never-ending story for a victim. Another level of threat and technique we saw and we mentioned is cyber espionage. So the motives are radically different. So they are not looking at financial gains. What they are looking for is first, obviously, to steal intellectual property. Second, to gather intelligence on the victim. And last but not least, to be in control of the reputation and to attempt to the reputational position of that person or that group or that hospital or whatever. How does it work? So usually you have a reconnaissance and a preparation phase. So state actor will not attack a victim without being prepared and without having proper reconnaissance. Once this is prepared, and an attack is launched, it has several steps. The first steps will be to infiltrate, obviously to gain access like criminals, for instance, with a phishing email, a spare phishing email, but exploiting maybe other vulnerabilities or backdoors at a level which is more sophisticated than the criminal level. Second is to maintain access. Obviously, a state or a state actor wants to maintain access to a system to be able to control this network and to see what is going on over there. Last step is covering tracks. Obviously, if someone is infiltrated into your network, you don't want to be, they don't want to be seen, they don't want to be detected. So they usually implement ways of cleaning their traces in logs so that the cybersecurity team doesn't see it. And whenever they want to withdraw from a company, they have ways to self-destroy a memory resident malware, for instance. But what is the goal for them? The goal is first, one of them is to compromise sensitive information, which is extracting data, which could be intellectual property, as we mentioned, but it can also be strategic planning, marketing plans, financial resourcing plans, and any type of information that is seen valuable. But that's not only the only goal. The second goal is possibility for a state actor to disturb or to disrupt services. So it's to prevent those to operate or to be operational, so that personnel have an eroded trust in there, and it can also be changing access rights. So everything to disrupt operations, so to slow down the operation of a victim. And last but not least, is also stealth data manipulation. In the case of Georgia Health Ministry, that what happened, there was an infiltration, and in this infiltration, some data were modified and documents were changed, for instance. And this is the goal to discredit the entity in regards to wider public. Third, and the one which is maybe the most underestimated, is obviously disinformation and infodemic. So what it is, first of all, infodemic is a contraction of information and pandemic. So infodemic is too much information. It can be the force of misleading information in a digital environment during a disease outbreak. So this is not new for the COVID. It also happened during the Ebola in 2014. And the idea is to have two angles. Either you do it from an information point of view that enables cyber operation, or from a cyber operation point of view that enable information. What do I mean by this? In the case of the information-enabled cyber operations, we see that it's not a new phenomenon, obviously, and the idea of proliferating false or misleading information is to attempt at the trust in authorities or in the victims. Some nations exploited the information ambiguity by spreading disinformation on the virus and its origin. But you have a main thread around this information-enabled cyber operation is it is always built around some piece of truth. So you confuse the mind of people, you confuse the masses on what can be true and what cannot be true. In order to prevent that or to fight that, the World Health Organization organized a cross-regional statement on the COVID-19 infodemic, and 132 member states signed this to avoid this disinformation campaigns. So some of the techniques are, for instance, trolls and trust farms. So trolls and trust farms is a group of people who will seek at flooding, for instance, social media with fake information or fabricating information, and will be spreading it through social media. It can also be from conspiracists who do not necessarily believe anymore in authorities, who are building their own ideas of the truth, and that finds some echo in the internet. And obviously, social media relay is an important element here, because the public is most of the time relaying these messages without necessarily assessing or verifying the source, and that could be a problem, especially in a major crisis. For the second part, cyber operation aim at manipulating data on the victim network. So we just saw that in the previous slide. Is the third part, where you would use the cyber means to infiltrate a network to modify data. So it can be, for instance, let's say you have a company which do research on a vaccine. You rely your research on the set of data, and if this data set is poisoned, obviously your conclusion will be also biased. And this can be quite dangerous for obviously patients and victim at the end. All this is done to undermine the public trust and opinion against, obviously, healthcare professionals on one side, but most importantly to associated authorities, can be ministries, government, and it adds or fuel a climate of fear and uncertainty. So who are those actors? So actors are in two categories. First category is cyber criminals and organized groups. Cyber criminals can be different from. You might have heard of script kiddies, of hacker, activists. It could be also disgruntled employee who are having access to critical system and on purpose destroy system access or system data, etc. But it can also be organized groups. Here in the healthcare sector, we mainly see operating organized groups, not so much activists, script kiddies, or disgruntled employees, but the most majority is more on organized criminal groups. On the state sponsor side, you have a different type of actors here. You have states with capabilities, meaning states who can develop their own capabilities. They have, like maybe in the army or in the intelligence, skilled personnel who can develop code, malware, infection software, and to cover all the chain we mentioned previously, like getting and maintaining access, cleaning traces, exploiting data, etc. Those are quite few. So some of the states who do not have those capabilities, they resort to an alternative, which is to purchase software that can provide them access to system remotely. So those software can be called also access as a service software or cyber espionage software. They are sold against a fee, and those companies who develop those software, they usually use vulnerability which has not been disclosed or they found themselves, that they exploit without the provider of the software knowing that this vulnerability exists. And it exists until someone else finds a fix for that. Last but not least, for some states also is to reach out to the criminal underground, especially hacker for hires or groups who are ready, kind of mercenaries, who are ready to help a state to act on their behalf. And they find usually mutual benefits. Cooperation links to some impunity. So a certain state might encourage a criminal group to help them achieve what they want. And in exchange, they will prevent any investigation or any prosecution to the people from the criminal group. And there will be some conditions, like they do not attack anyone in their own country. So who are the top ransomware operators? Today, we have around 25 main ransomware operators that are present. So if we look at the repartition, we have Maze and Egregor. So Egregor is now believed to be behind Maze, so it can be considered as a one. Then is followed by Conti, Reveal, Doppelpaymer, Networker, and the rest is accounting for around 80%. And each of these groups, we see they have a different way of infiltrating. They have their own methodology. So if you look at the infection vector for Maze and Egregor, is half of the infection is made through phishing, whereas for Reveal, on the left side at the bottom, phishing is a small part, and they prefer remote services. The ransomware operators, they obviously not target only healthcare companies. They also are very much targeting the education sector because it's seen as also a sector which lacks strong cybersecurity. But also the retail sector, same problem. And at the top also you see information technology sector. Information technology sector is a bit more harder because they know a bit more how to secure themselves, but the value they can get out of it is much higher than any other sector. So that's why they are also at the top of the sector. So what was very important for us is to look at the impact. Often we look at impact of cyber attack throughout the lens of business and economic cost. But at the Institute, and especially in this report, we wanted also to expand on 3 others, which we see as very important and which we saw was maybe a bit too understudied, which is physical impact on people. And are we able to have a causality between a cyber attack and the direct health of a person? The third one is a psychological cost. How much does it cost in terms of psychology, etc.? And the last one is a societal cost. So if we look at the details, the business and economic cost is, if you look at the data breaches, the healthcare sector is usually having 60% higher, greater than in other sector in terms of cost. But the financial cost in the aftermath of an attack, which is obviously ransomware payment, IT investigation, restore, public relations, can be huge and can be having no limit, depending on the size of your organization and the way you want to recover it. So the estimation is around 713 million on those activities. Intellectual property loss is difficult to quantify, but in short, you may lose years of R&D in a split of a second. So you may lose your competitive advantage over a competitor, over a criminal group that will sell it to your competitor. One element is business disruption and closure is real, especially if the crisis is not well handled. Nowadays, nobody can say that they will not be a target of cyber attack, but the most important is how you deal with this cyber attack, how well you deal with it. So your stakeholder and your shareholder will judge you on that. So if we look at numbers today, 60% of companies bankrupt within 6 months after a cyber attack. So it's mainly small companies that bankrupt. So you can see that it can have a direct impact on the society as a whole, and also on the psychological of people who are affected. Last but not least, reputational damages can be irrevocable and beyond repair. So managing reputational damage is really costly, especially in public relations, and an attack an attack can live forever in the internet. So nothing is deleted from the internet. So if you have been hit, you have been in the press, this can live forever on the internet. The second level is physical impact on people. Obviously, you have once you have a ransomware that disrupts operation, it has delay in patient care. It can sometimes endanger lives. If you look at the case of Düsseldorf, where a patient was redirected to another hospital, where the first one was unable to receive this patient because of ransomware, and the person unfortunately passed away during the transport to the second one, it means that it can possibly have a direct impact on the life of a person. Also the medical profession is unable to deliver services in a good conditions. So it's what I was mentioning a bit before is obviously you as a doctor, as an intern, you have to deliver service whatever happens. So even if your hospital is not having all the IT services in place, you still need to deliver some services. So you might need to revert to pen and paper, and it can be problematic if you don't have access anymore to medical records. So you may need to postpone surgery, to delay appointment, etc., etc. The psychological cost is not only on the patient, but also on the healthcare professionals, and it's a fear and sense of lack of control for medical professionals, anxiety in operating systems. So as you could see in the ransomware, healthcare professional are the person who clicks on the link and can spread the malware in the whole facility. So this puts additional pressure on those persons not to make any mistake on this regard, especially in this time of COVID, where those people have been tired, have been doing long shifts. Making a mistake can be easy to do. So it's putting a lot of stress on this population. Also, when you think about it, when your identity as a patient or as an employee of a company has been leaked out, and you have enough information that criminals use to steal your identity by creating fake identity card on your name, create credit loans at banks that you don't know about. It creates also a feeling of violation, betrayal, vulnerability, hunger, and powerlessness. And this is a feeling which is very strong and can have an impact on an individual for a very long time. I believe in France, it was estimated to recover from an identity theft, it takes around 8 years to be able to fix all this with the authorities and the different institutions, etc. Last but not least is societal cost is obviously infodemics, cyber espionage, ransomware has a direct impact on the trust within the healthcare sector on one side, but also the mistrust on the authorities and government. And obviously this disinformation operation has still some fear and confusion, since you don't really know what is true and what is not true. And some also, which is not mentioned here, impact on the society is combining the business economic costs, where companies close business. It means that really it leads to unemployment. This can have a direct effect on a country if it's heavily targeted. Last part of today's discussion is going to be on the legal ecosystem, and I will make it quick because I see that we are running out of time. To make perpetrators accountable, there's already a wide panel of law, norms, and treaties that can be leveraged better, but unfortunately today it's not the case. So you have human rights law, you have international law, you have international treaties like the Budapest Convention. Budapest Convention was created 20 years ago. It has been ratified so far by 65 nations. And it's a legislation that provides mutual aid between countries and that foster public-private cooperation and strengthen the criminal justice capacity globally. You also obviously have domestic laws, but also a number of voluntary and non-binding norms that can be better leveraged to help secure better the sector and to be sure we protect better the end user and the patients. Obviously, this is not desperate status. It has also some opportunities. So states should ensure that they work on rules of law and enforce the law in their own jurisdiction. And states are encouraged, obviously, not to violate other states' sovereignty and not to intervene in other countries' affairs. And the idea is also to respond and stop intentionally wrongful act from own jurisdiction. And those countries need to ensure that there's a right to life, health, and seek and receive information. Medical units, transport, and personnel should be protected all the time. And the current instruments which are already existing should be enough to make best use of cross-border cooperation mechanism. And if all this fails, they should be sure that they impose punitive measures on actors that are not complying with the law. On the healthcare industry, we mentioned that infrastructure are vulnerable, sometimes outdated. So it's a question of being sure to produce and secure product, especially security by design. So meaning securing from the moment the idea has emerged of creating a new device, comply with regulatory requirements. So it can be regional, local requirements. What is underestimating also is to inform about vulnerabilities. So there's a need to really share actively within the community incidents so that others are not impacted. So you have a forum for that, like what we call CERT, Computer Emergency Response Team. So it's teams in companies who share information, who respond to incident and could share information with others so that they are informed in advance and can prepare. Or ISAC, information sharing communities, where they exchange vulnerabilities and how they solve them. And all this is obviously to protect users, customers, and victims. So to conclude, we have made some recommendations in the report. I would invite you to read the report and to read those recommendations. Here we have a list of 4 of them. First one is for academia and civil society, where there's a need to really document attacks and analyze human and societal impact more thoroughly. And the CyberPeace Institute will continue to collect testimonies and document those attacks to be able to understand better what is the situation. Second level is addressed to government, healthcare organization, and industry to improve the healthcare preparedness and resilience. So helping all those potential victims to be having a business continuity program, to having a good cybersecurity regime, and to help them to grow and to be sustainable and resilient over time. The recommendation number 3 is addressed to government, so is to activate technical and legal instruments to protect healthcare. So we just mentioned that we already have some good instruments, but there should be better leverage. And last is addressed to governments, is to all the threat actors to account. So better prosecution and ensure that the rules of law is applied and that accountability is better implemented over the overall sector. This concludes my presentation. I would like to thank you for listening, and I think I will be taking some questions if you have. Thank you.
Thank you very much, Bruno, for a very, very interesting presentation with a lot of figures, relevant figures. Unfortunately, we don't have any time for questions. So I think what we can do is that we are going to post this video on our YouTube channel in a couple of days. And I have a couple of questions, but unfortunately, we can ask one question if it's okay with you.
Yes, I'm fine.
Yeah. What would be your main recommendation to reduce the risks on random attacks? Ransom attacks.
Obviously, you have a number of things you can do. Is obviously is to have a good cyber hygiene. So being sure that not only the IT professionals but cyber security professional knows what they do on your network and on your environment. But there's some awareness campaign inside the organization to prevent clicking on phishing emails, to detect suspicious behavior on computer or on a network. That's one element. And the second element is to be sure that patching vulnerabilities is done as fast as possible, that the network is segregated in different zones, so that if one zone is infected, it doesn't infect the whole network at once, and that there are some regular audits and pen testing to be sure that what you put in place is solid and there's no infiltration in your system.
Thank you very much, Bruno, and we really look forward to working with the CyberPeace Institute in future also for on collaboration. And thank you for your time and CyberPeace Institute for this session. And thank you to all the participants on social media. And here we are going to post this video in a couple of days on our social media and our YouTube channel also. So stay tuned for our future online public lectures. Thank you very much and have a very nice afternoon. Thank you.